So, good morning, student. Today, I have decided to discuss a very unique topic that infertility and the mastitis management. This is the topic which is very important, and we'll discuss in detail this topic. So, right now, I am sharing the screen with you, and you just wait for that how I'll discuss this thing with you. So this is a very important topic which I have decided to discuss with you. That today I will discuss the things that what are the important that are things those who are very important, and we'll discuss all the things that in what way actually the things will materialize. So anyway, now I am discussing this thing with you. You please see this thing that screen is on your head, so we'll see that how we can have the discussion on these two things. So myself, Dr. J.K. Sharma, I am discussing this thing with you, that concept of infertility, sterility, and mastitis management. This is the topic of the day, and I have decided to discuss this thing in detail. So I hope that after my discussion will over, then we'll have a very good understanding about the mastitis management also, and infertility and sterility. So let us, what are the objective of discussion? Let us have a first focus on that. So let us have a discussion on objective first. The objective of discussion is that we'll discuss the concept of infertility and sterility in dairy animals, and in dairy animals, important role of mastitis, that to be also discussed in the management sector. So these two things we have decided to discuss with you, and we'll have a thorough discussion on these two things. So let us have first discussion on that. What do you mean by the infertility and sterility? So these are the two things. They are very important. That first, let us have a understanding that what is the meaning of the infertility and sterility. So infertility is nothing. It is just the temporary incompatibility to perform the reproductive functions of any male or female. But the sterility is that where the permanent failure of the reproductive functioning, reproductive physiology, reproductive functioning. It means the infertility, we can have opportunity to reverse the situation and make animal fertile. But in the case of the sterility, because of that, it's a permanent failure of performing the reproductive functions. So that is why it's very important that the reproductive the organs, if they fail because of that, sometimes there is a misplace of any part, reproductive part, or sometimes there is a blockage in part, or sometimes there is a mismatch. There is in the infantile genitalia. It means there is not the develop properly the infantilia, that genitalia is not developed in a proper manner. So in that case, we know that all the things, they are very important, and because of that, we'll have a lot of things in our mind. So anyway, we will discuss these things. And the temporary failure, we know that the reproductive functions are treated as infertility, whereas the permanent and incompatibility is named as a sterility. So we have to understood that if the permanent failure is there, then there is no chances of recover that the reproductive functions once again by the animal. But in the case of the infertility, that is because of certain deficiencies, so sometimes because of certain that imbalances, that the nutritional requirement, because in 90% 90 95% cases, the infertility is because of deficiency of certain nutrients, certain nutritional deficiencies, and because of the hormonal imbalance. Most of the cases will find that the infertility is there. So reproductive failure sometimes it affects adversely the entire that business of dairy management, because this is very important, that if the animal is not in a proper functioning of the reproductive function, then how we can have a calf in a year in the case of the dairy animals. So if because we are doing the domestication not for the dung purpose, we are doing the domestication for the milk purpose, and milk can be produced only by the animals when she gave birth, timely birth of a young one. So that for that the fertility, that the sexual maturity and the reproductive functioning of all reproductive organs is very much required. And the infertility and sterility, these are the two concepts, they are very important from economic point of view. If the animal is not that much of that functioning is there, then in that case sometimes it happens. So we have to understood this thing, that how we can have the understanding of both of these things. So we have to, and there are plenty of reason for that, that why we have this kind of that thing is with us. So we have to understood this thing, that why the infertility and sterility, they are very important as far as the economic that activity of dairy animal is concerned. So we have to remember this thing, that there are plenty of reasons and causes for both of these, infertility and sterility, and how we can understood them, that to be discussed time and again. So that is why very important, that how we are handling them. So that the causes of infertility and sterility, for example, the anatomical cause, then the accidental cause, sometimes the physiological cause, and sometimes the nutritional cause, and sometimes the pathological cause, genetical reason also miscellaneous, and fault of management. So these are the few reasons, and we'll discuss them one by one in detail. Anatomical reason is a very unique reason, because if there is any defect in the anatomic of or structural, that manufacturing of structural, the development of genitalia, that is because of that. Sometimes if there is not ovary is not present, if there is no fallopian tube, then we can't have anything, because these are the situation where the permanent sterility will, the permanent failure of reproductive organ. But because of that certain the cyst formation or like that, then we can say that this is a very important reason. And because of that, if the things is happening like that, then it's okay. So then the sometimes the accidental causes, because of that we know that in the cases of the horses, or in the cases of the other, that sometimes the horse, when he mate the mares, because of the kicking, or sometimes the donkeys, the jack mat to the donkey, the she donkey, then because of that kicking of that, sometimes the situation, the testes, or sometimes the genetic that organ, that which is damaged. And because of that, sometimes the laceration, sometimes the when the male was in a position to insert the genetic organ inside the female, and during that process of that process, because of that the accidental, sometimes there is a rupture of that entire vaginal tube, or sometimes the rupture of that internal organ of a female, that happens because of the accident. So this is the second reason of the of that we can see, that this is very important reason. And for that we can see that happened to the uh, animals. Then the physiological, that sometimes because of any reason, we will see that sometimes the animals, that they are physiologically, they are not competent to handle the situation. So physiological reasons are also, because sometimes the hormonally that imbalance, that physiology is disturbed. Because of that, we know that there is an important role of that we know, that the hypothalamus for hormonal secretion in the body. So that is also sometimes the reason that the physiological reasons, they are also very important. So physiologically, if because of any that physiological failure, the metabolic that activity, sometimes the hormonal imbalance, the hormone is not produced on the time, then sometimes this situation is arise, to whom we are calling the physiological reasons. And they are also very much important. These physiological reasons are also very much important. Because of them sometimes it happens, and because of them sometimes there is infertility and there is a sterility. So physiological reasons mostly causes the infertility, because of the physiological reason, when we will go through the in detail, that for example, if there is no secretion of that gonadotropic hormone from the hypothalamus, because of that when the gonadotropic releasing factor releases from the hypothalamus, it induces the anterior pituitary, and the anterior pituitary lobe and the gland, and to release the gonadotropic hormone, which is having the two hormone, the FSH and the LH. So FSH, that the responsible for the maturity of the ovum or follicles inside the ovary, and then the luteinizing hormone, which causes the maturity of the ovum, and then rupture of ovum is also took place under the influence of the luteinizing hormone. And immediately then we have, that the through the ovum, the ovum, matured ovum Graafian follicle, to whom we are calling, that Graafian follicle, automatically when ruptured, then because of these the theca and the cell, though those the membrane, that secreted the hormone, to whom we are calling the estrogen. And that hormone is very important, that estrogen hormone, that animal bring into the heat. When she when the so my purpose of describing this hormonal physiology, if it is because of any reason, that if there is no secretion of any hormone on time, that causes the position of that, to whom we are calling the physiological, that failure of the hormonal system, and that affect the infertility. So for regulation of this thing, we have to check the entire that nutritional system of the animal, that why this situation is arises. So these are few things, those they are very important, and we have to understood that because of them sometime it happens. Then we will see that the another that reason is that nutritional reason. Nutritionally, we know that there are certain that vitamins and the minerals, those who are responsible for causing animal on timely on heat, or expressing the desire of sex, that is very important, because there are certain minerals that they are creating the situation, that we that, for example, the selenium and the vitamin E, if because of these deficiency of these two, or one of them, that causes that are having because these are the estrogenic hormone. So they are responsible for entire that activity which is being carried out inside the animal. So that kind of that, in the boron also sometimes causes the early embryonic motility. So that if the imbalance, and chromium also, there are certain minerals, that calcium, phosphorus, that they are also affecting. So vitamin A, we know that it's a growth promoting factor. So all together, sometimes these one, or sometimes all together, they are causing the status of that reproductive failure, to whom we are calling the infertility or sterility. So that is why very important. Then the psychological, that is also very important. Sometimes because of that the noise, or sometimes the adverse situation, sometimes the fear psychosis, because of these situations, sometimes the animal is not in position to have a ready to for the sexual that expression. And that is also and because of sometimes the psychological reason in human being, this is very very big issue. Because of that psychological, the pressure, sometimes the impotency generally observed in the male, and sometimes also in the case of the female, they not express their interest in sexual that behavior. So that is also very important, that psychological reason is very much important. And then we know that the pathological reason, there are certain that the bacteria, so the pathological reason, it means there is a certain infection inside the genitalia. sometimes, for example, there is an infection of Trichomonas fetus. That is a protozoal infection, and because of that, because of the presence of this trichomania or Trichomonas fetus, the animal is not able to conceive, and that is why the animal is repeated time and again. So that for that we if we identify that if there is a pathological reason, that for example I have taken the Trichomonas fetus, that the trichomony is there, and that Trichomonas fetus is very important, because that Trichomonas fetus, if sometimes it creates problem, then we don't have any issue. So we have to treat the animal with the anti-protozoal drug. But sometimes there is a mixed infection, with along with protozoa, there are certain the anaerobic bacteria is also there. For example, the Corynebacterium, and then the Pseudomonas, and sometimes the E. coli. It's a group of these bacteria. They are sometimes the causes the situation, the bacterial infection inside the genitalia, uterus. Because of that, the animal repeated time and again, and this situation is continue. So we have to very much understood that if we don't understand the situation, then we don't have any option. So we have to do this thing in our mind. Then there the pathological reasons, they are also very much important, that because of these microbes, or sometimes the protozoa, or sometimes the yeast and mold and fungal infections also, they may all together sometimes may cause the situation to whom we are calling the pathological infertility. And if we are not treating that these pathogens timely, then we have to face the situation. That is also very important, that permanent failure will be also there if we don't look towards this thing. So that is also very important, that while if there is any pathological infection in the body of the animal, then we have to address this situation. We have to use the intrauterine drugs, or sometimes the systematic drugs, through the intravenous form, or sometimes intrauterine also. So these antibacterial or antiprotozoal drug, for example, there are certain antibiotics, gentamicin, and sometimes the amikacin also being used in commonly drugs. They are very much used. And sometimes the antiprotozoal, for example, the tinidazole, and the combination of both of the cipro with tinidazole, sometimes the ofloxacin with tinidazole, because the use of these things, they are very important, and we have to use them time and again. And then the seventh one, the genetical reason. Sometimes because of that, we know that the situation of that. It's very interesting that sometimes the situation that if there are twins in the female, and in the female, and one is male and one is female. If situation was like that, and they born together, and during that gestation period, the male hormone, they suppress the growth of the female, the twins partner. So in that case, what happened, the female genitalia is not developed properly, and that female, to whom we are calling the free martin, because but this happen in the cases of the when they born together, the female generally we found very much in the cases of the free martin, and that happened because of the male hormone, the male fetus, that suppress the growth of the female partner. So that happen in the animal. So genetical reasons, sometimes they may, then that the mule, we produce the genetics. If there are the even number of chromosomes, if they are not there, then sometimes the situation is the mule we produce for different purpose. So the sexual failure of these animals are so common. So we have to understood this thing, that how and why these cases, they are to be taken by the genetical reason. So genetically, sometimes this is also happen. So we have to understood this thing, that why the genetical reasons are very much important. And then we have to have certain that thing, that the miscellaneous reasons are also there. Because of that, sometimes the that the bank disease, and the vibrio fetus and leptospirosis. These are also the reasons that because of that, you know that the brucellosis or bang disease, which is very common in the lactating animal. And but we, if we not address properly, then we know that there is no treatment after that, because it's a genetic disease. It transmitted from animals to human being. So when the animal, because the late embryonic, that the abortions we'll see after 5 months or 6 months, at 7 months, when we see that the abortions, they are there, that is a sign that early embryonic mortality, or sometimes the abortions, they are that premature, that deliveries. And in that, we can suspect the animals that to be suffering from the disease to whom we are calling the brucellosis. And brucellosis is a very dangerous that situation, because it's a genetic in nature. And then we have a vibrio fetus. In vibrio fetus, we know that the abortions will took place after, and in early abortions, that after 1 month, 2 months, or 3 months, or 4 months, we'll see the before 5 months. If we'll find that there is abortions, then we can suspect the animal for the bacteria to whom we are calling the vibrio fetus. Then there is also the leptospirosis and other diseases. They are also there, and they may cause sometimes the failure, that infertility. And if we'll not treat them, then it will be turned out into the input permanent failure, failure of the reproductive functions. And that to be named as a that to be named as a as a as a sterility. Because we know that the sterility is nothing, it is just the permanent failure or to perform the reproductive functions, either by the male or by the female. And we are discussing the things in detail, that what are the reasons for that kind of thing. So the fault of management, now the fault management also is very if we are not able to identify the animal on heat, if we are not able to inseminate the animal on particular time, because we have to understand the sign of heat, that sign of heat. What are the sign of heat? Let us have a one by one. In the case of the cow and buffalo, we know that they started while because these are the sign of it. They are just when she repeated these sign time and again, till she got the pregnancy, till she achieved the conception. So that is very important, that what are the sign of it. So sign of it started when she attained the puberty, and they are continuously thoroughly in the entire life span. And we know that the 15 16 that the conception is so common in the 15 16, that the gestation is very common in animals. So that is the productive life of the animal. So that these signs, to whom we are calling the sign of desire or sign of heat. And these, because in animals, when they sexually that behave only when they have that, when they have the sign of heat. So in the case of the female, she allowed male to be mated only when she is in heat. So because nowadays we are doing artificially all the things. Artificial insemination is very common practice in dairy husbandry. So if the dairy owner is not able to identify the sign of heat at proper time, then he'll inseminate the animal on time. So that is also very important, that how he manage the things or at a time. So that is very important, that how he or she identify the animal, whether she is on heat or not. So for that what are the signs? So first sign is that she started giving discharge at the vulva, that the viscous discharge, white discharge, sometimes yellowish discharge is there. And when she started showing restlessness, frequent urination, and we know that she started bellowing nice, and sometimes in the groups, when we send them for the grazing, the female started the mounting on other females or male. So that these are the signs that they are so common. And in the large dairy animals, the animal owners also, sometimes they are having the teaser bull. Then these teaser bulls, they when they started, because they judge because of the smell, they know that the she is in heat or not. Or when she accepted the male, then we see that the particular female is that cow or buffalo is on heat, so we'll inseminate through the artificial insemination. And this commonly, this identification of heat is very big problem in the buffalo, because that the salient heat is a very big issue, because salient heat is nothing, it is just when she not don't express any sign of heat, but she is in heat. So that to be very much important, because because once if we miss the heat because of any reason, then we have to fed the animal for 21 days, and for 21 days additionally. So this is a very economic that concern of ours. So we have to remember this thing very much, that how we can how we can how we can identify the animal on time. Then the fault management, that if we are not preparing the feed as per the need and the requirement and the recommendations of the animal on a particular age, or for their growth and development, then also we'll have so many problems. So that to be also addressed by the us. So and then if we not vaccinate, if we not timely give the nutritional requirement of the animal, if proper housing, if we are not able to provide the calm and the peaceful atmosphere for animal to express their important that the functioning. So that is very important. So we have to understand this thing, that how, in what way we are handling the animal, and that is very important. So I have discussed all the things in detail that regarding the temporary and permanent failure of the reproductive functioning of the animals. And next we'll have a discussion on these nine reasons we have discussed. Now we have we'll discuss the anatomical reason in detail once again. That there are certain situations to whom we are calling in the case of the male that the cryptocidism is a very important. Then it's reported to be heritable. No undecent testis. It means if the one testis is missing, or sometimes the testis is not in the scrotum or somewhere else, they are. So because of that situation, the male is not able to perform the reproductive functioning, and that too we call as a cryptocidism. Then the scrotal hernia is also the descent of viscera of into the scrotum. Sometimes the vast differentia, they are not properly that inside and that causes the importantia condi is also failure of detector of penis muscles to relax and extend. So these are few reasons in the case of the male. And then the free martin which neuter, to whom we are calling that when a female born with a male, a calf in a twin, female is sterile and called free martin. And it's happen in out of 100, sometimes 9. It means 9% only the chances. It means approximately 10% out of 100 cases, only the 10 will have a free martin or neuter cases. Because of that, under inside the gestation, we know that uh, the development of female genitalia is not possible under the influence of the androgen hormone or the male hormone, those who are being secreted. And we know that the fetus, male and female, both are sharing the same placental membrane. So that is why the female genitalia is suppressed by the male hormone. And this is very critical situation that to be addressed. And then we have, the persist hymen white heifer disease also we are calling. Sometimes the hymen, the outer covering of female genitalia is not ruptured on time. And then because of that, the male genitalia is not entering inside that, and the persistence of that is also sometimes causing problem. Then we have absence of some part. These are the anatomical reasons. Those I am already discussed, but I am once again I am discussing with you. Then accidental, that the brushing and and then in brushing we know that sometimes in case of this because we know that in the case of the donkey and in the case of the horses, because they are having the habit of kicking. So sometimes when male mounted on the female, on that time, that because of that habit, natural habit, she kicked on the testes of the male, and that to be crushed. Or sometimes the male, because of that, under the influence of that hormonal influence, that the male genitalia while entered in the female vagina, and the vagina to be brushed, or sometime to ruptured. And in both the cases, that to be happen because of the accident. So that's why these are the cases, those who are of accidental. Then perforation of uterine and vagina, that sometimes that happen. And then the prolapse of uterus and vagina also. The prolapse of uterus and vagina, these are the situation, they are also being caused by the female, while and this is a very common practice which is observed in the high lactating animals. Because of that, the mineral deficiency and other deficiencies, that the entire uterus sometimes, or sometimes the vaginal when a vagina um, came out from the vulva, and this to whom we are calling the prolapse. And that is very common in the lactating animals, high yielding animals. So we have to understood this thing, that these are all are the managemental problem. Psychological, I know that the physiological reason is that the impaired sexual maturity, that is one of the then the lack of gametogenesis. We know that the libido also, if there is no libido, then how we can have the sexual behavior. then anestrus also, then infantile genitalia, infantile ovary, then the persis corpus luteum, then the ciliate hint, then the short cycles also, sometimes the cystic ovary, there's the cyst inside the ovary. So these are the physiological reason of the infertility and sterility. Then nutritional deficiency, we know that the carbohydrate, fats, and protein, minerals, and vitamins. If anyone is in the deficiency, that to be causes the repeating, and that to be causes of abortion, that to be causes of so many so and so consequences. And then we know that the pathological reason, that the brucellosis and the bovine, the vulnerable trichomoniasis, then the vibrio fetus, then the abortions in between the 4 to 7 month, and the leptospirosis that the pomona, and non-specific also, sometimes the vaginitis, self-rigid, and the metritis, cervicitis, and pyometra, where the pus formation inside the genitalia. Also, these are the reason that genetical reason I have already explained, that sometimes because of that genetic, that we induce that mule, or sometimes that because of that there is no big, because of that the uneven chromosome number, that mule, because when we produce purposely this thing, then it's okay. But because of sometimes the naturally some situation arises, when the chromosome number uneven, then the definitely the male or female, that to be sterile, and there is no reproductive development. So these are also reason. Then we miscellaneous, we know that the age, the season, temperature, light, etc., sometimes the proper managemental failure, that is also very much important. So these are the few reasons, those I have discussed in the detail. Now I'll discuss a very unique and very important that managemental problem, mastitis. Mastitis is nothing, it is just the inflammation of udder and uterus, udder and teeth, and that is very important. The memitis also this is also being called as a memitis, and itis, it means it's a mammary gland inflammation. But this is the disease actually which is most dangerous in subclinical form. Although it's very dangerous, but in 2-3% cases, the disease observed and found show the sign of it, because the sign of it when reaches, then this is it's a subacute and acute position, and that to be situation where we have a definitely few losses if we not treated the animal for a few hours, then there is a fibrosis inside the udder, and then that quarter to be over, the show of that quarter to be over. And once if the animal entered in the subacute and acute mastitis and the chronic situation, then it can't be reversible. The production will be affected for lifetime, whatever the production loss is there. And if fibrosis being took place, then we don't have any option. And that quarter, the particular, out of the four, one quarter, if mastitis is there and it is converted into the fibrosis or chronic mastitis, then we don't have any option. That animal cost remains 75%. So that, and this mastitis is also very common phenomena which you observed in the high lactating animal. And just after the parturition, this situation, so many times this situation is observed. So first, the 10 to 15 days of parturition, they are very important, because at the time the animal is not that much of that immunity inside the animal, because she processed through the traumatic situation of the parturition, although it's a natural situation. But because of that, the entire, that the feed intake and everything was disturbed. So because of that, and because of that, the heavy blood loss and all the pain and agony, and all the things the animal is passes. So in that case, what happened, the animal is little bit already, the immunity of natural immunity of animal little bit depleted. So in that case, what happened, the and bacteria, those who are inside, and immediately she has to produce the milk for the young one. So that the all time, the high energy requirement is there, but because she is not that taking proper feed, and that is the reason there is highly imbalance inside the energy requirement and in the supply in the body. So that kind of situation sometimes leads to subclinical ketosis also, and that subclinical ketosis, we know that it's a metabolic failure. So that is very important, and we have to understood this thing, that these are few things those who are very important from managerial point of view. That's why the mastitis, when the bacteria, those in the environment, they got the opportunity and milk production, and immediately that the young one, the calf, they are suckling the teeth. So sometimes the the residues they from their mouth, they are also remain at the teeth. And we know that after that milking or every that the suckling, the creatine layer in the teeth canal, that is actually the natural that blockage, natural the protein layer which inhibits the any entrance of any outer that bacteria or sometimes any microorganism. But because of the cap of the keratin layer is wipe off 40%, 40%, 50% during the milking process, and the regeneration of this entire that keratin layer took place 20-30 minutes. So that 20-30 minutes, that time there is no keratin plug inside the teat canal. So that is very good. And the atmosphere on and around of the teat and udder is also hot and humid, and sometimes the fractions of milk are also there, because during the suckling or even after the milking, we don't have that habit of washing the teat and udder by the clothes. So that is also very much reason that the entire that situation is very much favorable for the microbes to enter inside the body of the female. And that is a time when the infection carried out inside the body, and that bacterial infection grow like anything. And we'll see that and normally in our country like India, because the farmer, they are not that much of they don't have that consciousness. So they are not putting their all efforts to avoid this kind of situation. And because of that, the subclinical mastitis, we have 70%, 70 to 80% animals, they are suffering from the subclinical mastitis in general. So that is economic loss, because if the animal is suffering 70% of the animals, it means if 5 to 10% milk production loss is there. So if we correct our that managemental practice, then we can have with the same feed and the same managerial practices, we can enhance our that herd average of the dairy farm. So these are also very important, that how we are dealing with them. And that is very important, that mastitis is a very 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 important disease. So we have to understood this thing, that the inflammation of other physical and chemical change in the milk, major economic loss to dairy industry due to reduced milk production, subclinical and the acute. And the chronic one, then there is no treatment. Causes bacteria originally the Streptococcus, Streptococcus, Corynebacterium, and E. coli. Transmission infection occurs via a teat canal, contaminated environment, skin of udder, milking equipment, milker, etc. Symptoms: hot, swollen, painful udder with purulent yellow secretion, rise in body temperature, enrollment of other udder, and cessation of milk secretion. Milk secretion becomes blood stained and may contain pus. So quarters may be completely affected, and in some severe cases, an animal may die because of the toxemia. If we are not handle the situation properly, then the diagnosis, early diagnosis, detection is important by physical examination of udder. May Many kits are available for diagnosis because the subclinical form is also economically damaging our animal, that the entire business. So why don't we check at any initial level? Treatment: effective drugs are available for treatment. Control: hygienic that measures are important. Animal diagnosed positive should be milked at last. Milkers should wash their hand before and after milking. That to be very much important. And a separate clean cloth each cow is to be used, that is also very important. The first stream of milk each quarter should not be allowed to drop on floor, but collection in a separate that container. Milker should not wet their hand. We have to take care that hygiene of the milker also, that is also very much important. That then the normal milk room hygiene, including washing milk, then the washing of teeth. Don't allow animal to sit after 20 minutes of milking. And also keep the entire the milking parlor in a clean manner, and also disinfectant time and again. So there is not a situation like that, the bacterial load to be reduced. So these are the few important things, those I have discussed in thoroughly in detail, that how we can have this thing. And then the normal milk hygiene, including washing of containers and equipment, should be practiced. So these few things, those were very important, and I have discussed in detail that about the mastitis. And mastitis is a very dangerous that situation, because it's economically and adversely hurting our entire that business. And we are helpless. We cannot do anything in that case. So we have to take the corrective measures, and we have to correct the situation. And that is why the mastitis is very important. And this disease is generally found in subclinical form in 70 to 80% animals. So that is also very much important, that if you identify the mastitis, subclinical form of the mastitis, and will take the necessary corrective measures. Because the managerial, that's why the mastitis is being called as a managerial problem, not as a disease. Because we know that if the SCC count, the somatic cell count, that increases in lakhs, per lakhs, we have a 1% loss. For example, if generally the 2 lakh is okay, but in a level of milk, SCC count. But if it is increases 3 lakh, 4 lakh, 5 lakh, like that, in this order, so each lakh increase 1% loss. It means 3 lakh 3%, 4 lakh 4%, 5 lakh 5%. So like that, if we have 8 to 9%, it means in general the subclinical state is 8 to 9%. That 8 to 9 lakh, that SCC count is in the normal in our Indian condition. So it means we are not milking our animal 8 to 9% less. With the same managerial practice, we have opportunity to enhance our milk production 8 to 9%. 8 to 9% of our milk production increment without doing anything, with the same feed and almost the same managerial practices. But we have to tune up our all the managerial practices in respect to the mastitis. So if we able to do, we will have a more that 8 to 10% that milk production with the same feed and animal. So that it means, in the case of the India, where we have a 776.3 million metric ton milk production annually in 2019. It means 1920. So you can imagine that the 10% of that, it means it's on and around 18 million metric ton, that milk production we are not collecting from the animal. So it's that amount that we can feed to entire European countries or European groups of the countries. So that to be understood, that how much loss is there. So mastitis is not only because the symptoms of mastitis we'll see at the acute and subacute situation. That to be very rare, only in 2 to 3%. So it means the rest of 70 80%, those animals, those who are in the subclinical form, because of the poor managerial that practice which we are generally in general we are adopting. So that to be understood by us, that how we can have this kind of situation. So we have to diagnose the animal on time and again, and we have to adopt the all the good managerial practices. Those, they are very important. So I have discussed the things in a manner like that, the two important things that I have completed in this discussion, the first one is the infertility and sterility, and then the mastitis management, and both are having the economic impact on the dairy business. And if we don't identify the infertility and sterility on time, then the animal will only we are domesticating them for the purpose of the dung only. So that to be very much that understood by us, that what are the issue. And then the mastitis management is proper, then we can have the entire thing in our hand. So thank you very much for participating in the lecture. So I have ultimately I have completed the entire thing, the infertility, sterility, and the mastitis.